With 35 years experience in physiotherapy, if someone came to me and said, please explain physio, keep it simple, explain what you do. So to me, this is Physio on Ross 101 basics. Now, if someone walked in with a concern, I need to eventually try and work out what's going on, and through my physio skills, I will then ultimately devise a program in the end specific to them. It's individualized. We need to minimize all aggravating factors, but find out what is their specific issue. Now, really, in a nutshell, I'm looking for areas that aren't moving well or stiffness, but I'm also looking for areas that aren't well stabilized or controlled, or potentially a little bit of weakness. And depending on what's going on, you will get your program specialized towards that issue. So if I'm on a spine, on a lumbar spine, I will palpate individually the vertebra and work out what's going on. Now, even though you say it's tender, if I feel that it's moving, there's no point giving stretches. Your problem to me isn't stiffness. We need to potentially get better muscular control and stabilize that area. But if I find that the area is quite stiff, yes, you will get stretches. And that's how two different backs could come in with similar sort of concerns, might end up walking out the door with two completely different home programs. Also, if we look at muscles are pulling forces, and I apologize on my art, it's not the best, but muscles go from one region to another, and mathematically they're pulling. Now, if a muscle is tight, that body area will handle that for a while, but eventually it'll say, I've had enough. There will be a breakdown, there will be pathology, there will be symptoms. Now, if we look at muscles almost like vectors, mathematical pulling forces, and I've done a left knee here. So up here is the body and the hip, that is the thigh, the femur, with a kneecap or patella going down to the shin. And it's a left one front on, so this is the inside of the thigh, and that's the outside of the leg. But specifically around a kneecap, muscles come and join onto that kneecap, and there's a muscle down the side here called the ITB, and it is pulling in a lateral direction. There's also another one that comes in that goes up to the front of the pelvis called rectus femoris, and again it is on a slightly lateral force as well. If we go into this area, a little hollow in the knee, that's called the VMO, or the vastus medialis oblique, and that's an area, unfortunately, that tends to waste away. These two are different macroscopically, and under pathophysiology, they tend to tighten. This one tends to weaken. As a result, we've got more lateral pulling than medial pulling. So as I get onto a knee, I will check these two out. If they're tight, we need stretches. But if they're fine, there's no point being on a roller on your ITB. It's not specific to you. Your neighbor or your colleague might. But if they're good, we need to strengthen this one and also look at ergonomics and all that sort of stuff. So all I'm trying to say, physio is about normalizing movement, making it efficient, making it pain-free. Through our skills, if something is tight, you will be led towards some stretches, it will be written down, it will be specific to you. But should an area not be tight and it's more in the weakness, you will get light strengthening. Now, often there's a little bit of both, but to me, that's Physio on Ross one-on-one, keeping physio nice and simple. Keep it specific to you, what's tight stretches and what needs strengthening. We give some light strengthening. Nothing though is to irritate you after. If it is, we need to change that program, we need to modify it.